Hello, and welcome to Telling Your Asset Management Story. Today, we're joined by Ron Drummond, whose career has taken him through contracting, consulting, and into leadership roles managing facilities and capital projects across multiple hospital campuses. In healthcare environments, buildings and infrastructure can't take a day off. Systems need to run reliably every hour of every day. In this conversation, we'll talk about Ron's journey into the field, the realities of managing aging infrastructure in a high-risk environment, and how teams are balancing workforce challenges, energy costs, and emerging technologies like predictive maintenance and AI.
Ron, thanks for joining us on Telling Your Asset Management Story. For the audience, Ron and I used to work together back around 2004. And since then, Ron has ventured out into the healthcare facility asset management space. And really excited, Ron, for you to share your story today for our audience. So, Ron, we always start with basically asking our guests to tell us about their journey. So how did you get to where you are now?
Yeah, I think if you asked me when I graduated from the University of Ottawa in mechanical engineering in 2000, would I be in this place, 25 years later? That's absolutely not what I would have thought at that time. I graduated from the University of Ottawa. One of my professors gave me a job application to a mechanical contracting firm that he thought I'd be a good fit at, and I applied and I got that job. And at that time in Ottawa, it was the tech boom. So I started as an estimator / project manager, doing a lot more estimation and project management. But working on the contracting side and taking off plans and figuring out how building systems went together. Going to site, delivering checks to the guys working on site and doing site review. And I thought that was an absolutely great experience. And I found that being in that space sort of really tickled my fancy for what I've always really liked about engineering, which is putting things together, seeing things get built. And it went from there. So from mechanical contracting, I went into consultancy where I would run into you at Jake Swifford. And I'll tell you, that experience was phenomenal for me because frankly, I think that Jake's did a really great job of exposing you to a whole lot. We didn't, as a mechanical engineer or at that time in EIT, I wasn't just doing mechanical engineering stuff. I was going out and doing soil sampling when people needed a hand. I was seeing really the whole gamut of things. And I think more importantly, they just exposed you to so many different systems. So as a mechanical engineer, I know I was doing financial due diligences. I was doing building condition reports, worked on that big school board project that you were running at the time. And frankly, that was fantastic. I got to travel as a young person. I saw buildings that I never would have seen otherwise, which always sort of intrigued me was, what's going on behind that. So many different building systems, such good people around you to teach you about what you were seeing and reporting on. And I think just from there, it really grew. And at Jake's, I had another great mentor, Rob Treby, who was at the time a chemical engineer, getting into energy audits and whatnot. And under his stewardship, I really started getting into the energy space, which is where I've kind of played since then. So worked with the energy team at Jake's and went on to a design builder from Ottawa, delivering large scale industrial heat recovery projects around North America, which again, such a great experience to get out and see the world and do engineering work. And I had kids. My wife asked if I could probably be more local. And that kind of led me to facilities management. I got a job with the National Capital Commission in Ottawa, which stewarded all the federal lands and federal buildings in the National Capital Region, and dovetailed that into a position with the Official Residences of Canada as their facility manager and energy manager for that portfolio, still within the NCC. But that was a fabulous experience. My first time really leading FM teams, developing capital renewal plans, setting the vision for that portfolio and doing it in some of the most historic buildings in Canada was a blast. So I was there for about 8 years doing that work. And I kind of told my boss that I'd done everything that I thought I could do here that was interesting. And he helped me, try to grow my career to where I wanted it to be, was somewhere where the infrastructure was going to be in need of fixing, huge energy demands, and so we focused on education and healthcare. And I landed a job with the Montfort Hospital, delivering a $15 million energy project, which is primarily infrastructure renewal. And whilst there, they made me also director of infrastructure and in charge of security and parking and everything else. And you see
everything else under the sun.
Yeah, exactly.
Yeah.
Oh, you're good at this. Well, you're in charge of this now too. So that was absolutely great. I think coming to healthcare has been one of the greatest moves of my career. The mandate is tremendous, and the impact is also super, super great. So while at Montfort from about 2018 to 22, delivered that project. We reduced energy by 20%, which is so important, especially with the rise of energy costs. And I use that position to springboard over to the Ottawa Hospital, where I'm working now. We run 3 campuses. I've got about 150 people working for me, both on the facilities management side and on the capital project side, and trying to replicate, honestly, what was done at Montfort. Such great people to learn from. Just trying to keep our people engaged and renewing these assets.
That's awesome. Can you tell us a little bit more about your current portfolio, like in terms of the size and the types of buildings and that sort of thing? You mentioned 3 campuses, 150 people. Let's dig into that a little deeper.
Yeah, so I think our CEO, let's say like 1 hospital, 3 campuses. So we've got the oldest campus, which is over 100 years old. It's called the Civic Campus. It has 600 beds. It's slated to be sunsetted probably early 2030s. We've got a new campus being developed essentially across the street from it. It's in development right now, probably open around 2031, 2032. Don't quote me on that. That hospital is it's fabulous, honestly. It's 1 campus, but it's 17 buildings, varying vintages from 4 years to 103 years, all coming with the complexities that come with interconnecting systems over time to deliver patient care. It's a first-class plant, so we have a boiler or a centralized heating and cooling system. The boiler plant is first class, so we have a first-class operating engineer, second-class engineers, third and fourth as well, which is its own sort of dynamic and pressure. Beautiful guys, though, just brilliant guys, operating engineers. But many of them at our second classes are also chemical engineers, mechanical, electrical engineers. So really smart guys, super facilities team. So that's the Civic Campus, about 1.8 million square feet. We've got the General Campus, which is about 2.5 million square feet. The facility side, the facilities team is about the same though as the Civic. So each of those sites have about 60 guys, plumbers, electricians, carpenters, instrumentation, fire alarm technicians. I'm forgetting some of the guys, but all of them are important. Both those sites are acute care 24/7. Civic Campus is our trauma care center for the region. We also accept patients from up north as well to get cancer treatment down here at the General. The third campus is the Riverside Campus. I don't want to say it's the forgotten child, but it's the one it's outpatient. About 450,000 square feet. We have a small team of FM professionals over there, 3 operating engineers. It's a small 4th-class plant, but we've got millwrights, electricians, plumbers, door mechanics, that sort of thing over there, and one property manager to manage operations, renovations, projects, etc.
That's awesome. Well, it's interesting when I talk to folks about buildings that have many additions on them, I often use the term Franken building, right, where they're just stacked together. Now, after hearing you talk about the 1 campus that you're responsible for, I think I'm going to create a new term called Franken campus, which is the campus that has been built with a building that's 100 years old and then up to 4 years old. So I'm gonna coin that new term for that type of campus, because
I like it.
That obviously, and having that diverse age, that diverse, different campuses, different programs and things like that, I'm sure provides tons of challenges and gives you lots of opportunity to use that diverse experience you got from, contracting, construction, consulting, and FM. So Looking at your three campuses, and maybe there's different challenges at different ones, but what are sort of your top three challenges from an asset management perspective that you and your team are kind of tackling? And then what strategies are you using to address them and overcome them?
Yeah, so I mean, we're public, right? So like money is kind of like front and center when it comes to that. But I won't talk about the money because that's easy to talk about. I think the biggest thing, and I mean, you know this, and you've talked about it on many of your podcasts, is it's that aging infrastructure and the deferred capital renewal that goes with it, right? So you mentioned
I'm
earlier,
glad you didn't say deferred maintenance. Well done. I like it. I like
well,
it.
I try my best, and because that actually is the reality, right? Is
Absolutely.
frankly speaking, our guys do a very good job of maintaining the systems here, and in
Yeah.
many respects, to their own detriment. You've done
Oh,
such a
absolutely.
great
Yeah.
job maintaining the piping, the chillers, the boilers, that you've essentially pushed it well past its expected useful life, and that's a burden. When you talk to the team, it's a burden. They know that things should be replaced, but healthcare is an interesting space to play when it comes to deferred capital renewal, because all hospitals also have ambition and growth opportunities, and it is the lifeblood of healthcare, is to expand into the region and deliver more services. So we must continue investing in cancer technologies and research and all those other things, but sometimes it comes at the expense of things that are hidden behind the walls. So our strategy with that is, as the hospital continues to grow in its stretch in the region and at the campuses, is to try to marry up some of those great opportunities with our big ticket items. And that's something that over the last 3 years, I think it's become a much more harmonized approach when we're thinking about installing a new linear accelerator to treat cancers or whatnot. Is what is the actual cost there, and how far can we go? Let's actually put that number in front of the board, so that we're making a real holistic a decision around
Right.
those
Add it,
things.
add in some of the deferred capital renewal adjacent stuff to that plan. That's what you're kind of
Yeah,
talking
absolutely. Because
about, right?
I
Nice.
think when you deal with campuses like ours, and you know what, we talked about the Civic campus being 100 years old, but the general campus is 50, and the Riverside Hospital, where I was born, is almost 60 years old. And I often try to parallel buildings with the body human. So when I think about myself, I'm about to be 50. The general campus is about to be 50. These buildings are expected to be like humans. 80 to 100 years is what we're going to get out of them. At the half-life, we need knee replacements. Maybe a heart needs a little bit of work, the little surgery here and there. But those are necessary to ensure that building gets to the next stage and eventually sunsets, right? So it's that conversation, I think, is something that our CEO and our CFO have been really attuned to, and listening to what the problems are. They recognize that the infrastructure has been pushed to its limits, and now it's incumbent upon us as FM professionals to let them know what the plan is, so that the buildings do remain open, they don't have any unforeseen shutdowns, and we can continue to deliver care. But it's not easy, and in fact, a lot of that comes from the frontline guys that have been here for 25 or 30 years. They help to prioritize the magical list that comes from the province as to what we should deliver. They're great help in prioritizing that. So I'd say that's probably number one. Number two, in terms of challenges, would be workforce sustainability. And I'm not sure how much you've heard that, but we talked. I got 120 guys who are Red Seal certified. Many of them could definitely find jobs outside of healthcare that pay more. And as that whole pressure gets put on the trades to fill all these people who are retiring or have already retired.
I was just going to say, most of them are probably in that older age range, within 10 to 15 years of retirement, probably.
Absolutely.
Too, right?
It's a huge pressure on us. And I'll say, when I got here to the TOH about 3.5 years ago, our turnover in trades was around 12 or 13% year over year, which is just, it's insurmountable. Really, you're constantly recruiting, and you're trying to retain at the same time and backfill all of your retirements. That loss of corporate memory is huge. The investment in training is huge. The investment across the organization to recruit is huge. So we've have focused on that particularly over the last 3 years. We did a trade salary review, compared ourselves across the province, and tried to right align our trades and attract the best. Like, we're really trying to attract our best, and we've gone from that 12% range down to just over 1.5 right now. Yeah, which has allowed us really to focus. It's unbelievable, and in fact, it's probably the best thing that's happened to us, because it's allowed our teams to get really conversant with what they're seeing. Healthcare is not easy. Learning healthcare is even harder. And coming from the outside, like the specialized systems that we have here, even if you're a guy like me who thinks he's pretty conversant when it comes to engineering and engineered systems, it's the same thing for the trades. It's a big learning experience, how to properly service an MRI or these specialized systems that are here, even where you're going in healthcare. It's huge. So
how has the mission kind of, I mean, obviously in healthcare, you've got a great underlying mission, right? Of providing a healing environment for the sick, for newborns, for all of that. Has that played into your retention and recruitment efforts at all in any way?
Well, it's interesting, because I think once you get into healthcare, you kind of think you know what it is, but once you are here for even the short term, you start realizing the impact that you do have.
Right.
I'll say it's the one thing that's kept me in healthcare since I joined, is that attachment to the mandate. And we try to talk about that, at least at the managerial level. I try to push that down. Like, what attracts you to the job besides the money, besides the pension? Like, why are we here? And when we fit into that whole, we're like delivering world-class patient care for that our loved ones sort of deserve. We try to frame that for facilities management. What does that mean? For us, it means like developing and maintaining the world-class infrastructure to support that mission, and trying to communicate that to the guys, like that they're healthcare workers. They're not just
I'm not sweeping the floor. I'm delivering world-class healthcare, right?
And we just had an engagement survey conclude, and there's a number of things that came out of it. Some of it were like, still more money, still more this. Yeah. But when they asked, what keeps you here, like, a lot of it came down to team, and a lot of it came down to the mandate about what they.
Yeah, that's awesome.
So that's like, in order to recruit and retain, especially the retain portion, I think it's important to really embed that end state, that mandate into the group. And I'm hoping from hearing it from the top sort of trickles down, and then having the guys bring that back up in these surveys or in one-on-ones in the hallways. It's fulfilling for me as well.
Number 3.
I think a lot of people talk about energy and sustainability, but I think I'd rather focus on energy costs.
Right.
So like we've enjoyed a really long period of fairly low energy costs. We had a little blip a couple of years ago with the natural gas, but it's kind of receded since then. But when I look at what's really going to impact the built environment and facilities, that's what comes home to me. We talked about infrastructure renewal. We're hearing from our LDCs, our local distributors, that they're in the same boat. And they've communicated what those increase in rates are going to be to help them renew their infrastructure. And it doesn't mean good news for us in the short or the medium term. So that's the importance is there to deliver now on trying to reduce our own energy consumption to mitigate the effects of what's coming for electricity and natural gas as well. Right, natural gas is with the U.S. and Canada developing all these LNG plants. That gas is going offshore. Our costs are going to come up as a result. And even look at in Ontario, you've got the nuclear refurbishment going on. When nuclear falls off, natural gas picks up the weight, if you will, or the gap to produce electricity. So that is something that concerns me. And as a result, we're pretty focused on trying to reduce our consumption any way we can.
Yeah, so it's not about long-term energy savings. It's a hedge against future costs to just kind of flatline, right? Is kind of the strategy I think I'm hearing.
Yeah, absolutely. And which is like, it plays beautifully, from a communication standpoint, because the investments that we're making in our infrastructure not only reduce our greenhouse gas emissions and lower energy, but moreover, it's about keeping the lights on. We're
Yeah,
talking about millions of dollars a year, and it compounds, right? It's not
absolutely.
static. It compounds as those rates come up. Our payback looks better. But if we don't do that investment, we are going to be hit pretty hard.
Yeah. No, that's awesome. That's lots of challenges, lots of moving parts. I mean, you're really lucky to have the senior executive kind of leadership and buy-in to even want to talk about deferred capital renewal, because I know a lot of folks, they don't. It's I was just at a conference this week, and some folks were like, we can't even talk about it because nobody even wants to hear about it anymore, and that sort of thing. So the fact that your leadership is engaged is a huge benefit. And obviously, looking from today, turning our lens to the future, Ron. What do you see in the next 5 to 10 years in terms of how facility and asset management are going to change? You talked a little bit about cost of energy that went into the future, but what other areas do you see evolving and changing over time?
Yeah, like I think it's kind of a multi-pronged thing here, Bill. But like I think about the way that FM is being delivered is going to change. In the public side, we're seeing a shift towards the outsourcing of
Okay.
FM services, which in some respects is great, and in other respects, I have some concerns about that outsourcing. So, we talked about the trades. Renewing the trades is difficult, but when you don't have that in-house knowledge, you lose that corporate memory. And I have found, because I've worked in environments where we've had outsourced FM, that the attachment to that end mandate isn't what it could be. Not that it's not there, but it isn't what it could be. So that's something that is coming, and I understand why it is coming. And I would hope that the same amount of investment that's putting into outsourcing also. I often say when we talk about these things that the amount of money that we're putting into outsourcing to guarantee an output at 30 years with a building, we could still accomplish through insourcing if we funded it to the same amount and tied it to key performance metrics, right? So from that standpoint, I'd like to. That is something that a conversation I'd like to have and see explored more from people like you and my counterparts about like what the benefits to that is. So we talked about that. What was the question again?
The future. Yeah,
No.
that's all right. Yeah. No, the evolution of facility and asset management over the next 5 to 10 years.
Oh yeah, sorry, absolutely. So the one thing that we're sort of exploring right now in FM is the whole AI and data-driven approach, moving from preventative maintenance to predictive maintenance, automating response intuitively from AI models. I'm enthralled by that idea. And I'm excited to see what it can do to better deliver resilient operations for us, especially in our buildings that are not 24/7, where we don't have someone at the helm, if you will. I think there's real opportunities for that. Predictive maintenance that's AI driven. I think also frees up time for our personnel to do more value added interventions within the space. So super excited about that. A little bit. I think if I had a commercial portfolio, I'd be like, both feet right into it. Acute care, trauma care. I'm not really ready to give Skynet like the the keys, if you will, but we're gonna try it in areas that are less critical and see where it goes from there, and see what it can deliver to our guys in terms of more time to do things that are more difficult and still requires that human touch.
Right. Yeah. Well, yeah. I think the whole pilot concept in anything that you're doing new, I think is really important to validate, particularly before you go into those more high risk environments, right? And things like that. So that's a great, that pilot approach is one we recommend in everything we do as well, and ties right into the way that you guys are tackling it.
Well, I think one thing I've noticed in healthcare is that it's about building credibility. And I think FM has really it's changed a whole lot. Like I can remember like doing our building condition reports and whatnot, and all those conversations you're having with the frontline personnel during those investigations. It's changed so much, and it's only been 20 years. Like it's a really different environment that we're in right now, the focus from regulators is that much more intensive, I'd say. The TSSA just in April sort of shifted their mandate to like a really high risk approach. Being a hospital, like we're right in that bucket, so the scrutiny gets even more focused on how we're delivering our services, which means that within a very fixed capital or operational budget, you still need to maintain what you're delivering plus these additional tasks, and they're not light tasks to tackle. So,
No. Well, and often it's the same bodies that are telling you to be more stringent that are the ones that write you the checks to do it, but the extra money doesn't come in. So it's really how do we do this and how do we do everything we have been doing and this new thing with the same money that we had before this new thing showed up, right?
Yeah, and it's about shifting priorities and finding people on your front lines that you might be able to expand their role a little bit to try to help with that gap. But I do find in healthcare, it's been going back to that credibility piece, is starting off with small interventions, demonstrating that you're able to shut down systems for 1 hour, 2 hours, so you can get towards an 8-hour intervention or a 16-hour intervention, right? It's been a lot of fun working in healthcare. It's been a lot of fun seeing our trades be able to do intensive maintenance on systems that they never thought they'd be allowed to before. But it's a credit to them to figuring out exactly how they're going to do it, describe how they're going to do it, and they're working with the clinicians and other stakeholders to make sure that they can shut down the electricity or the oxygen or the hot water or the steam. It's a lot of fun. It's a lot of fun.
That's awesome. Well, and I think that idea that you brought up before too about AI is that, look, AI is not going to replace people. It's going to allow the people we have to do more, right? And so many people in FM have been asked to do more with less. Now is AI going to be the opportunity to do more with the same number of people, so that and resources overall, so that you can have a greater impact with the same number of folks, especially when you can't hire people and it's unfilled roles and things like that. So it'll be interesting to see how that journey goes and hear how you and your team are able to get those benefits.
Yeah, I suspect that the initial rollout of AI is going to mean more work in the short term, because I think that it's going to pick up a whole lot of things that we didn't even know about. So I think to your point about capacity, it's about also framing those interventions with perhaps some outsourcing required at the onset to deal with that influx.
That's interesting.
So you can get down to a stable point where it is a manageable expectation for staff on hand to actually accomplish that thing. I do think there's going to be a mountain of interesting things to have to investigate when it first comes out.
That's interesting. Yeah, I've always sort of looked to the end state, right? Where here's where we are today, and here's where we're going to end up. But I wasn't really thinking about the hill to climb to get over to that new normal. That's a really interesting perspective. So, and yeah, if it's identifying things that you didn't know you should be doing, then there is more to do in the short run as you figure it out. That's really interesting. Ron, anything else that you want to share with our audience, either about the future or just in general related to facility or infrastructure asset management?
I think the biggest reflection I've had since coming to healthcare is that I've been, I think, pretty vocal to like my peer group about how much healthcare needs really excited and intelligent people working in healthcare. It's a great community. It's very collaborative. I know, like in our region, we've got a little group of FM professionals awesome. that get together to share their stories and share their practices, so that we're not reinventing the wheel every time something comes up. The other thing that community of practice being integrated together is when something does happen that's critical, we now know what other hospital partner may have that part sitting over there to get you back in operational in a quicker timeline. And it's been really valuable to try to do that I don't want to call it the sourcing of spare parts, but ensuring that
Yeah.
The hot spares are available. So if and when something happens, and it will happen, that you can get your building back up and operating right away. We sort of talked about it like a little bit before about that aging infrastructure. Part of
Mhm.
that aging infrastructure is that there's I can remember 10 years ago, we would go on the Amazons or the eBay at the time, and you could find what you were looking for out there. We're
Right.
getting to the point now where all these specialized systems from 10, 15 years ago, it's end of service, it's end of life, there's nothing available. So it's about trying to build that capacity within a region about like, if and when something fails here, where do I go
Yeah.
to try to keep ourselves moving forward?
That's awesome. Well, I mean, it's certainly that collaboration, that peer-to-peer feedback, right? Why not learn from the challenges and the mistakes of other folks? Why not help each other out? If you've got two of these pieces of equipment and you don't have, somebody else doesn't have any and they need one, move it around. That's awesome, and that's the power of that peer-to-peer sharing and network. And so and you mentioned the passion, for where FM needs passionate folks. And obviously, Ron, I mean, you and I have known each other for a long time, but your passion for this sector comes through in everything you've said in this interview. And I want to say thank you so much for sharing your story with us and our audience. I think it's added a ton of value, and it's going to be exciting to share this as part of season 2.
I really appreciate it, Bill. I love talking about what I do, and I'm really happy that you started this community, if you will, online. I found it really rewarding to listen to other people talk about what they do and how they do it.
Awesome. Well, thank you very much. And thanks to our audience for listening to this episode of Telling Your Asset Management Story.
Ron, thanks so much for sharing your story with us. What really stands out is the critical role facilities teams play behind the scenes in healthcare, ensuring buildings, systems, and infrastructure are always ready to support patient care. Your experience reminds us that reliable infrastructure depends on knowledgeable teams, long-term planning, and thoughtful investment. Thanks again for joining us on Telling Your Asset Management Story.